So for everybody that's online, thank you first for being here. All right. And what we have tonight is we have a program called, well, you see it in front of you. It's called Mental Health in Multiple Sclerosis, although it does say MS. And this is a virtual online program. And for tonight, well, you know me. My name is Stuart Schlossman. I'm president and founder of MS Views and News. I too have multiple sclerosis. That's an entirely different subject. Okay, tonight's topic, sponsors for tonight's program, as you can see, is Bristol-Myers Squibb and Biogen. All right, and what do we have next? Well, we have Dr. Rick Harris, who's our speaker tonight. All right, and Dr. Rick Harris, you can see the topics that he's going to be discussing. If you've never heard Dr. Harris, and I'm saying that because Dr. Harris speaks many times for MS Views and News. All right. He's been doing this with us for many years in person. And of course, this year virtually. If you've never heard him, you will be like, why haven't I heard him? OK. And why can't I not hear more of him? All right. So that will be you'll be listening to him in a second. The topics you already saw. Again, this is about the challenges of depression and anxiety for the current age and living with multiple sclerosis. So here we go. Dr. Harris, get started. Take it away.
As always, I want to thank Stu and MS Views and News for this opportunity to share with you my expertise and experience in treating patients that have MS. The first thing I want to talk about is, I know Stu mentioned the MS and the effect of mental health in MS, but when we look at any chronic illness, we need to look at the challenges that one faces. And I break this down so that we all can understand what are the factors that contribute to mental health issues with any chronic illness, and not only with a chronic illness, but also with any mental health issue. And as you can see, the 4 factors are biological, spiritual, environmental, and psychological. And as you can see the way this is drawn, there's a complex interaction between the 4 factors. That the biological factor can affect who we are psychologically, our biological can affect us spiritually, our environment can affect us. So it's important to understand not just one of these factors contribute to our mental health issues. And we're going to break this down in our time this evening. We're going to look at all 4 of these factors. But of course, I'm a psychologist, so my priority is looking at the psychological factors. We know that, next slide, please. We certainly know that there are mood disorders in people who experience MS. And a mood disorder is defined as a sustained and pervasive emotion that influences perception of self and the world, such as depression and anxiety. The focus in MS has been mostly on depression. However, anxiety is also important and noted, and we're going to talk a little bit about both of those. Next slide. So often, people ask me, Doc, what's the difference between sadness and depression? What's the difference? And so the difference is that to really meet the definition of depression, one must have at least 5 of these symptoms, okay? And the first one, obviously, is depressed mood, most of the day, nearly every day. And there needs to be a marked diminished interest or pleasure in almost all activities, most of the day or nearly every day. And if you listen to what I'm saying, these symptoms are persistent. They're not fleeting. It's most of the day or every day. We see in depression, some people lose weight. They lose their appetite. and others will gain weight. They end up craving, and so often they end up craving carbohydrates. So it can be a weight loss or weight gain. We also see sleep disorders in those individuals that have meet criteria for depression. Either difficulty falling asleep, staying asleep, or, on the other hand, wanting to sleep all the time. We also see agitation, feelings of being agitated, or feelings that they're leaden, that they just can't move. Things are heavy and it's difficult to get going and move. Fatigue. And it's interesting because we may touch on this a little later. Fatigue is a pervasive symptom of MS. Right? If I remember correctly, almost 80% of all patients that experience MS will experience fatigue. So it becomes important to be able to do what we call a differential diagnosis. Next slide, please. There's feelings of worthlessness or guilt nearly every day. And remember, clearly it's that nearly every day that distinguishes sadness from depression. Diminished ability to think or indecisiveness. Recurrent thoughts of death are also consistent with a diagnosis of depression. If these symptoms persist for 2 weeks or longer, that is depression and not just sadness. So let's take a look at, next slide, please. So what's the prevalence in MS of depression? The research shows that between 25 to 54% of all MS patients will experience some sort of depression. 50% will have a significant period of depression through the course of their illness. Higher rates than the general population. This incidence is significantly higher than the other population. And when we control for other chronic illnesses or neurological disorders, the incidence is considerably higher in MS patients of having depression. There's higher rates of suicide and suicidal thoughts. Most important, depression often goes unrecognized. One of the reasons why I'm sharing this information with you is so that you become aware of what those symptoms are, so that if you have any one of the symptoms that we talked about before, you feel free to talk to your physician or a caregiver about it, because it's so often unrecognized and is treatable. What causes depression in MS? So often the etiology can be the diagnosis. At diagnosis, one may get depressed, a reaction to MS, relapses can precipitate, also changes to brain function also need to be considered. Medication, side effects of medication can also cause depression. Next slide, please. So I also mentioned that anxiety is also experienced among patients of MS. And we see that the incidence is also considerably higher. It's 16 to 48% among MS patients. And it's often noted alongside the first symptoms of MS. It's an understandable emotion. It's kind of linked to fear. It could be due to diagnosis, or symptoms of anxiety may come from MS lesions. Like depression, it can be treated very effectively, but it's important to understand the etiology. Next, please. Slide. So often, again, we talked about the difference between sadness and depression. What is the difference between nervousness, anxiety, and fear? Fear, as we know, so if we're sitting in our room right now and all of a sudden we hear this incredible roar and we look over our shoulder and there's a big grizzly bear there, our body's going to respond. There'll be a physiological response to that threat, that grizzly bear that we see in the room. Our heart rate will increase, our breathing may get heavier, we may break out into a sweat, we may have a feeling as if we're not there, and it might be difficulty breathing. What's happening to our body is it's getting ready to either fight or flight. That is called the sympathetic nervous system. So fear is an actual threat to our well-being. Anxiety is a perceived threat. We perceived threat. So, before when Stu introduced me, I was a little anxious. My heart rate went up. I got a little fidgety, and you'll see me, I'll kind of dance around a little bit. I'm a bit anxious. That's a perceived threat. I want you all to get something out of my talk today. I want you all to like me. I want you to like this presentation. That can be a perceived threat. You're not going to hurt me. And if I bomb tonight, it's not going to really affect my life. But I perceive that as a threat. That's what anxiety is about. But let's take a look at what those symptoms are. Again, all of this is so you can be aware and note, because again, it's treatable. It can be helped. So the symptoms of anxiety are the presence of excessive anxiety and worry about a variety of topics, events, or activities for a duration of over 6 months. The worry, the what if thinking, is experienced as very challenging to control. The anxiety and the worry are associated with at least 3 of these physical or cognitive symptoms: edginess, restlessness, getting more tired or fatigued than usual, difficulty concentrating, sometimes feeling as if your mind go blank, some irritability, increased muscle aches or soreness, difficulty sleeping, restlessness at night, or unsatisfying sleep. Next slide, please. The anxiety worry is also associated with symptoms that make it hard to carry out day-to-day activities. They may cause problems in relationships or work or in other important areas, such as my own activities of daily living. Am I afraid to leave the house? Do I have a fear of, do I get anxious about going to the physician and so I don't keep my appointments? The symptoms are unrelated to any other medical condition and cannot be explained by the effect of substances, including drugs or alcohol. And the symptoms are not better explained by another mental disorder. So I want you just to be aware of the symptoms of anxiety. So often, again, I'm asked, what's the difference between anxiety and excitement? Those of us that think about this for a minute, we're standing in line as, hopefully, at Disney or Universal Studios. And we're standing in line and we're looking at a roller coaster. And someone says, oh my God, I'm so nervous. What if it breaks down? What if I get stuck? Their body's responding to that. the person right behind them and saying, "Oh my gosh, I'm so excited. I've been looking forward to get on this ride for a really long time." They're experiencing the same physiologically, but it's their thinking that's different. And that becomes so important when we look at the treatment of anxiety, because it's really about helping people change their thinking. Hopefully, I'll have enough time to talk about some things that we can do to change our thinking so that we can decrease our levels of anxiety and worry. I'm not going to get into this in such detail, but there's also different types of anxiety disorders. What I just shared with you is the symptoms of what we call a generalizing anxiety disorder. Next slide, please. I'm going to skip this one, Bill, and I want to go to the slide. I think it's let's go to 14. So what we've talked about is anxiety, depression. We certainly know that there are cognitive changes with MS. And as I mentioned earlier, there's also fatigue. And the numbers with fatigue, I said it was 50%, but it's actually 80% of people with MS will experience severe fatigue. 100% will report fatigue at some point in their life. Let's take a look at environment. Next slide. What's the impact? How does MS impact our environment? What we see is 27% of people report loss of personal income. 46% of MS patients are impacted negatively on their work life. 32% had to take some time off. 15% reduced their hours. 16% needed accommodation. 10% stopped work. 6% changed careers. 6% had to take a less demanding job. Think about that. Not only does the environment impact our experience of MS, and we're going to talk about that in a minute, but MS impacts our environment. And that's why there's complex interaction. So if I've lost my personal income, it's impacted my work life, there are losses, and that will impact me psychologically. Next slide. So Stu mentioned that he was grateful that he has been fully vaccinated, and he shared with us his experience in that this burden has been lifted off of him. I can't tell you the degree that COVID has affected each and every one of us. The mental health issues that are associated with COVID are so significant. Next slide, please. When we take a look at, and I want you to realize, this was statistics done July of 2020. 35% of the people surveyed indicated that they experienced anxiety. 28% reported that they were depressed. 48% reported they were both depressed and anxious. So almost in July of last year, almost half of all the US population reported some degree of depression and or anxiety. The national statistics is about 10%. So there was an increase, significant increase. We've seen this in our practice. We've seen this in the individuals that we're treating. We see it from little ones to our senior citizens. But what's the impact on us as MS patients? Next slide. So if you remember, I said the prevalence rate, okay, for MS and depression was 25 to 54%. The COVID prevalence was 28%. That's an increase about 20%. So if I take just the general population and I say that within the MS population, that there's an increase of 20%, we're looking at incidence between 45 and 74%. That's significant. When we looked at anxiety, the MS prevalent rates were 16% to 48%. There was an increase of 17% in general over the prevalence of anxiety in the general population. COVID and MS, the range was 31% to 65%. So COVID definitely had an impact on our mental health as MS patients, much more significant than the general population. And think about that. Why? Social isolation. Couldn't do our normal activities. Had to be isolated in our house. Our losses were more profound and more at the forefront. So COVID definitely had an impact on our mental health issues. All right. So let's, next slide, please. Next one. So as you notice, the next factor that I wanted to talk about was our spiritual side. What do I mean by that? These are psychosocial factors that contribute to our mental health. Studies have shown that social support has been shown to be associated with depression, and the treatment of depression has been associated with utilization of social support. What do I mean by that? Those people that use social support systems have a lower incidence of depression than those that don't. In some ways, what we're doing tonight and what Stuart's done with MS Views is created a network of social support. It is so important, our mental health. Lower levels of social support are associated with depression. Higher levels of support are correlated with better adjustment. Next slide. MS patients, let's talk about treatment. MS patients are not adequately treated for depression. There's a lack of service, there's a lack of understanding, a lack of awareness on the patient's part. That's why knowing those symptoms becomes important. Medication's not the only way to treat depression. There are other things we can do. The best research shows that the best treatment for depression is a combination of medication and therapy. Treatment of depression uses a combination of addressing the problems, the MS symptoms, and increasing social support. Individual therapy can be extremely helpful in the treatment of depression. Sometimes depression can affect the family and can affect our relationships. Sometimes family therapy our relationship therapy becomes so important. Next slide. So, what can we do? And this is the manual that I'm hoping that I can help you with and see. The first thing to recognize is our coping style can really affect our mental health in dealing with a chronic illness. When we looked at coping styles, we broke them down into two basic styles: emotional responding and problem solving. The emotional responding coping style is the one that goes, oh my God, what's going on? Why is this happening to me? And responds to a problem emotionally. And needless to say, we find that that coping style causes, or there's more incidents, I'm sorry, it doesn't really cause, more incidents of depression and anxiety. The other coping style that we find to be more effective is what we call problem solving. Not asking why, but asking how and what. What can I do about this? And laying out a plan on how to deal with this. The other thing that we found is perceptions. I so often talk about looking at what I have rather than what I don't have. A gratitude list, being grateful for the things that you do have. So often in a chronic illness, we start to say, what have I lost? It's better to start to think about what I still have and to be grateful. The other thing we find that contributes so much to our mental health issues is our what if thinking. And if I have one gift I could give to each and every one of you, this would be the one skill. Next slide, please. So often we have a chronic illness. We ask ourselves, the mantra is what if? What if this happens? What if that happens? And that results in our feeling anxious. So what can we do about that? So here's a little nugget, a little skill that each and every one of us can employ that will make our lives so much better. Time. Time is an abstract concept. I'll say to you, I'll see you next week, Tuesday at 7:00. That is an abstract message, an abstract concept. Time we invented to coordinate, I'm sorry, not create, but to coordinate events. I'll see you next Tuesday at 7 p.m. That doesn't exist. The only thing that exists in time that's tangible is this moment that we're sharing together. You can hear me. You can see me. We're experiencing this together. That's tangible. One then has to ask ourselves, does the past exist? No, it's gone. Some people say, well, I have a memory. Yes, you do. Memories are awesome. But it doesn't exist. It's just a thought. The next question one must ask ourselves, does the future exist? Gosh, no, it hasn't happened yet. The future has not happened. The only thing that exists in time is this very moment. Well, given that, do you have control of the past? No, it's gone. I have no control over what happened. The more difficult question one must ask ourselves, do you have control of the future? We'd like to believe we do. But the truth is, not one of us has any control of the future. That doesn't mean plans or goals are not important, but plans and goals are important for us to recognize they are what we would like to see happen. Goals are what we would like to see happen. They're our own personal reality. We do not have control of the future. The only thing we have control over is this moment, this here and now. So when I hear myself say, Rick, oh, you should have done that, or you could have done that. If only I wouldn't have done that, I wouldn't have MS. If I would have lived a healthier lifestyle, I wouldn't have heart disease. We need to realize that anytime we hear those words, coulda or shoulda, I'm living in the past. And I'm causing myself guilt and shame in this very moment. When in this moment, I'm not feeling guilt and shame. What we become so good at in our society is the words, what if? Whenever you hear those words, what if? Be mindful, be aware that you're putting yourself out in the future that you have no control over and causing yourself anxiety in the moment. So be mindful, be aware, the coulda, shoulda, wouldas, the what ifs, and be able to say to yourself, stop. Moment to moment, be here now gives me more control of my life. I wish that I could just give all of you that particular gift. Be here now. For those of you that are like music, there's a wonderful artist named Jason Mraz, and he has a song called Living in the Moment. And whenever I find myself out there thinking, what if? Just hit my little play button and listen to Jason Mraz's song, Living in the Moment, because it really helps us being centered. Let's see here. I'm going to run out of time here, so I want to just go to, let's go to slide 28. So one of the best things that we can all do for ourselves, particularly in the light of what's going on in our environment, is to breathe. And if you notice, I have a little caricature of what I call belly breathing. Those of you that have ever practiced yoga or played a musical instrument know about diaphragmatic breathing. Diaphragmatic breathing is breathing and using your full capacity of your lungs. And so if you all will, I'm going to ask you to do this along with me. The first thing I'm going to ask you to do is to take a big sigh. How many of y'all during a stressful day just find yourselves going, oh. Why? Because we're letting go of that air and it gives us a chance to take a deep breath. So the first thing we do is we recognize that our lungs go all the way down and fill our rib cage up. And the first thing we do is we sigh, and I'm going to exhale. Let's do this together. Exhale. And now we're going to inhale through our nose, but we're going to take a very deep breath and allow yourself to fill your lungs up to full capacity, and you feel your diaphragm move out. And then we'll exhale, and exhale through your mouth. So we're going to inhale and exhale through your mouth, but slow the exhale down. Inhale. Inhale to a count of 2. Exhale to a 4. And just allow yourself to do that for just a couple seconds more. All right, let me see a show of hands of how many of y'all feel a little more calmer and relaxed. I hope you know I'm just kidding because I can't see you all. But my sense is if you did this with me, there's a sense of being calm. And there was a great psychologist said that as a busy mind can't live in a relaxed body. And this is one technique that can help relax us and get us to feeling more calmer. Next slide. So we've all heard about this mindfulness and meditation. Mindfulness is just us being aware. There's a part of us that can observe who we are and what we do. Mindfulness just allows us to be a little bit more aware. Meditation is just a state of being deeply relaxed. When we did our little breathing exercise, that is a form of meditation. So often people will say, well, you have to empty your mind. You have to get rid of the thoughts to meditate. If you get rid of your thoughts and empty your mind, I'm sorry, you're not living. It's impossible to do. The better thing in meditation is just to allow your thoughts. You don't have to pay attention to them. Just spending 5-10 minutes of doing that breathing and meditating and being mindful can be extremely, extremely helpful. I'm real conscious of time, and I know, Stu, is it time for questions?
I'm in and out. I'm in and out. There you go. All right, great. Thank you. Thank you. Thank you. So I don't know how. First off, thank you very much for speaking. I don't know how, but when you asked everybody to raise their hands, which was funny, but Bill, my video producer, sees that there was 60 likes out of 67 people. So that was pretty cool, you know, that you were able to do that. And I don't know how they did it, but they were able to do it. So whoever clicked on like, thank you very much. That was great. Thank you. All right.
You know, people don't realize that we as speakers have absolutely no feedback of we're connecting, if what we're saying with people is resonating. You know, when you do a live talk, you can tell the audience and you feed off of it.
That's
so
right.
I appreciate every like I got. Thank you.
Thank you. Thank you. Yes, thank you. And, you know, for everybody that's out there, yeah, we're doing these virtual programs right now, but MS Views and News is underway of planning one program per month starting in June. One program per month right now of getting out to a location and doing live programs again. And we will do them as a live stream as well for those that cannot be there. But we will be doing socially distanced live programs, and we are the first MS organization in the country that is going to be doing this on a monthly basis. So that is a great thing. And, you know, that's also going to help the mental wellness of a lot of people who just have been dying to get back into, you know, being able to get out and see their friends and be able to go out and listen to these programs. And of course, eat the food, right? You know, something different. All right. By the way, Celia, I know you wrote, you thought I was sleeping, but there's no way. All right. I mean, if you knew me, you only know I sleep 4 hours a day and I don't have time for sleep. Okay. So we do have questions that are coming in, and I will ask again for everybody out there, if you have a question to ask for anything that Dr. Harris spoke about this evening, please, or anything that's related to what he could possibly answer, then please keep it all relevant, and we will be able to ask these questions, okay? One other thing before I get started with the questions is that our program tomorrow night is called MS Patients Voices, and this is a program that I started earlier this year where I sit down virtually with other MS patients who are doing things, whether for their real life work or just things that they've developed during COVID that benefit the MS community. And our guest tomorrow night has a website, and she's got an organization that says that reads, "What would I miss?" And this is for people who are depressed, all right, and how to get people out of depression. And it's for those, though, that are contemplating suicide, what she does, not what we do, all right? I mean, we don't commit suicide, right? But her dialogue and what they teaching people to do is to work with people you might know, all right, who are so depressed that they're contemplating suicide. And basically, the idea is to speak with them about what would they miss, okay, and make it so that way they will miss it so much that they don't want to do anything to themselves, all right? So this is something that, we hope that whoever's online that wants to hear this tomorrow night, just go to the MS Views and News website and get signed in for that program, okay? All right, now, we got people's questions. I've got questions on paper. I've got questions on here on the internet. We'll start first with the ones that are on paper and take it away from there, right? First one is, interested to hear what the current thinking is with regard to patients who, prior to being diagnosed with MS, had been diagnosed with depression and anxiety, and how it may progress over time.
So certainly, if you've experienced an episode of depression or anxiety prior to the diagnosis, that you're going to be more vulnerable to experiencing depression or anxiety with the stress of being diagnosed and the stress of a chronic illness. It's almost as if we see these disorders that they do run in families. So there is a genetic vulnerability to the mental health issues. But certainly if you had an episode, the likelihood or probability is that you will with the stress of being diagnosed and throughout the course of the illness. Again, don't be discouraged. And I can't, there are extremely effective treatments today for depression, for anxiety, that are real effective. So again, don't be discouraged. There is, again, effective treatment. So if you've had an episode prior, just be aware the probability is much higher that you will through the course of the disease.
Okay, thank you for that. Another person is asking, how do I maintain certain appointments that require someone to accompany me without me having to have the fear that that person is not going to be able to accompany me?
Aha. What if?
What if?
What if? I mean, all of us are what if thinkers. So the better way to deal with that is the person I asked, they made the commitment. My what if thinking is doing nothing to help me except cause me anxiety about that appointment. If that person doesn't go or doesn't show up, I'll deal with it then. I can't deal with something unless it happens. So just be mindful and say, wait a minute, stop. What am I doing? Be here now.
Okay, thank you. Another person wants to know if you have any information on cognitive decline and executive function issues.
Do I have any? Sure. It's
a question.
Yeah, it's. I'm not sure what the real question is. There are certainly, as we've said, there are certainly incidence of cognitive changes with MS. I mean, it occurs in 45 to 60% of people with MS. 80% of all MS patients are mildly affected, and it's related to everyday activities and the quality of life. It's also associated with our own coping strategies. If I have that emotional response coping strategy, I'm more likely to have cognitive changes rather than the problem solving. The most common, if you would, reported difficulties, cognitive or memory, attention, planning and problem solving, information processing, word finding, okay, and visual spatial problems. And it can fluctuate. It doesn't have to be chronic, but it's very common in MS. And those are some of the most common symptoms that are reported of cognitive functioning.
Okay, thank you. All right, let me take one from online. Even though I know my insight is quite good, according to me at least, this is by somebody named Cindy. How do I truly move beyond and put those insights into practice? How do I jump the hurdle, the brick wall, which seems to be getting higher and higher every day?
You know, that's a great question, Cindy. So I've developed a very simple 3-step method to change. And I've coined it the Rick method. And it's RIC. The R stands for recognize. Recognize the behavior or the thought I want to change. And it sounds like, Cindy, you're having those insights, right? The I stands for insight, having insight into that thought. But change only occurs when I confront that thought. So the C stands for confront. Recognize, insight, and confront. That is the 3-step method to change. Now, one of my patients said, Dr. Rick, what about the K? And she said, I guess what you're saying is we need to keep doing this. So the K stands for keep doing it.
Okay. More to that, or am I cutting you off? I'm sorry to hear that.
I'm done.
Hey, great. That's great. That's great. I don't know. Sometimes you tail down in what you're saying, and I don't know for sure if you're going to come back and shock us all with something. All right. Okay. So next, the person wants to know if Elavil is still used for MS depression.
Interesting. Let me share this because this is so important. The state of the treatment, the state of pharmacology in the treatment of depression is exponentially improved within the last 5 years. It's no longer looking at which antidepressant treats which disorder or subtype. We're now able to do gene testing. We're able to take a sample of your saliva, look at your genetic makeup, and determine which medication is best for you and your own body. In our experience of doing this clinically, we found 95% first trial treatment response. No longer do we have to trial and error. So, in answer, Elavil was an old school antidepressant, but it may not necessarily be appropriate for the individual, not for the disease entity of MS. We're all individually different and have different genetic makeups.
Great, thank you. All right, Val from online says, what about treatment-resistant depression? Can you speak about TMS?
I've not had much experience with TMS. I've done a lot of work and research into the biological causes when I was the executive director of a neuroscience center. And I've seen some real promise with TMS. And it's transmagnetic stimulation. And it's a little magnet that appears over this particular area of the brain. And it stimulates the brain functioning. I've had a couple of patients report it has been really, really helpful. But before I would do that, I would do gene testing to make sure that my antidepressant medication is appropriate for me. And the company, if anyone's interested, it's called GeneSight. And you can Google GeneSight. The outcomes are pretty phenomenal. So it's interesting because we're starting to see things like TMS, ketamine infusion. Ketamine is a tranquilizer. And they're starting to do infusions with that. And the research is still a little new on all of that stuff. More recently, they're using some of the old psychedelics therapeutically, like psilocybin, which is a mushroom. In the last published research study for at least post-traumatic stress disorder showed that psilocybin can be effective. So before you consider TMS, do some gene testing, make sure you're on the right ones.
Great, thank you for that. Can you tell us about biofeedback? Big topic.
Oh, yeah. How much time we have left? I'm kidding.
Well, so why don't we break this down? I know that there's the one that you can do yourself as like self-mind control. All right, and then there's your version, which is using electronics. So why don't you go with that? Why don't you go with that version?
Very, very simply, biofeedback is simply the process of feeding back to us biological processes that are not normally considered under our control. So, for example, I can say to you all out there, hey, I want you to lower your heart rate. And if you have any good judgment at all, you look at me and go, you crazy shrink, how am I going to lower my heart rate? However, if you were wearing your new state-of-the-art iWatch, you can turn it to your heart rate. And by just having that feedback, your brain will be able to figure out how to lower your heart rate. Biofeedback. What we're doing in our practice is a form of biofeedback called neurofeedback. So many of the disorders we treat, including anxiety, migraine headaches, insomnia, etc., are dysregulation of brain functioning. If I can measure the electrical activity of your brain, I can, and I can say to your brain, I want it to be better regulated and more stable, and I'm going to give you feedback to when your brain achieves that. We will successfully teach that brain to be better regulated, and we see symptoms ameliorated. That's the process of biofeedback. A particular type of biofeedback is EEG biofeedback or neurofeedback.
Great, thank you. All right, next one, long question. Person writes, I've been on Prozac for years now for depression and anxiety. My doctor prescribed it when my first child was born over 2 decades ago. I'm curious if others are taking any antidepressants. What are they, and are they working for them? Can you give us any insight on that, Doc?
I think antidepressants and anti-anxiety medications are the number one medication that primary care prescribes. Medications should be individually determined. So often our physicians will prescribe their favorite name, not necessarily what's appropriate for me or my symptoms. I love the gene testing we do. It takes all the guesswork out of it. So in response, yes, there's a majority of people that take antidepressant medications. And they are helpful.
Okay, good. Thank you for that. All right. Martha writes, what if my husband is in denial and doesn't want to do anything for his MS?
Wow. That's really difficult. You know, when anyone's in denial, the best thing you can do is to point out the behaviors of what you see. You can't point out the denial. You don't want to be critical because what happens? People dig their heels in. But you can point out the behavior. If you see him having more symptoms, you can say, hey, husband, I'm concerned. The best way to break through denial is express concern and to point out the consequences of not dealing with it. That's the best way. That's such a hard thing to do.
Okay. Thank you for that. Next one. Joy is asking, does insurance pay for gene testing?
Yes, depending upon the insurance carrier. Yes.
Okay.
Yeah. But the company we deal with called GeneSight will work with you and will, if your insurance doesn't cover it, works on a sliding scale.
Great. Thank you. Does that include Levi's and Gloria Vanderbilt? Jeans, everybody, jeans. Okay, that's all. Just trying to make a little joke. Okay.
Got it.
Yeah, good. I'm glad. It's getting late for some. All right. Carolyn asks, does Rick have a website with more information?
There's two, westonpa.com for Weston Psychological.
Spell it.
WESTONPA, P as in Paul, A as in Apple.com. That's my major practice. That's good enough. Don't want to confuse people.
Right. Good. Thank you for that. All right. Next one. We've only got a couple of questions left.
Whoever that was, thank you for asking.
That was Carolyn.
Thanks, Carolyn.
Okay, great. All right. Cindy again. Regarding depression, you have said that social support is so very important. Is there such a thing as fake social support? To explain, people tell me they understand, but they never really do. It is very exhausting. Is there anything you can say about that?
Ooh. Is that really social support if someone's faking it? Change your support system. If you don't believe that those people are really being supportive, like, why be there? So change your support system. Look elsewhere. I mean, there's online support groups, MS Views and News. Tune in. Stu's doing an incredible workshop tomorrow night. That support. Look for support that you get something from, not that you feel like it takes something away from you.
I did not pay him to plug me. Okay.
I just appreciate what you, honestly, this is
Thank you.
not, I appreciate what you do so much.
Thank you. That's because I'm trying to live in the moment. And I love that song. I love that song. Ever since you mentioned it a couple of years ago, I made sure to get it in my phone. And every time I'm driving down the road and I just need a little pick me up to get me back on course, that's the song I play because it is a beautiful, beautiful song. So for anybody that does not know about living in the moment, find it. Go online and check it out. All right. It's a great song. All right.
I mentioned it a couple of years ago, too.
People are answering. I listen to it every day. And another one, it's a great piece and so on. All right. Michael is asking again for you to please mention the name of your website. And I did write westonpa.com. Is that what you said?
Correct. Yes.
All right. WESTON. I'm going to just put it out here so everybody else can see it as well. And then I'm going to ask another question. So www.westonpa.com. Okay, and now everybody will be able to see it in a second. There you go. Okay, great. All right, next is So a person writes that they want to know they have family that are against what they're doing, but they have a habit to chill out from the day is having 1 or 2 drinks a night. And whereas they don't find anything wrong with it, they have family that constantly badger them about having those 1 or 2 drinks, even though it's after 9 o'clock and it's just to mainly help them sleep.
Ooh, who cares what the family thinks? Tell them to buzz off, damn it. It is your body and your life. And as long as, the simple response to that is a simple definition of addiction: continued use despite negative consequences. If you're a couple of drinks a night and there's no negative consequence to that, and you don't find yourself going from 2 to 3 to 4 drinks a night, tell your family to buzz off. It's your body. It's your temple. Don't. As one of my patients once said, don't walk in my head with your dirty sneakers.
Well, I hope that nobody gets shot tonight after he tells them that. All right. So Lisa's saying, thank you for this webinar. Another person's writing, this is fantastic. We should do this more often. You're right, we should. And so we are. So just before I get into the next set of questions, I just want to let you all know that MS Views and News is now doing like between 8 and 11 virtual programs a month. And like I said before, we are going to start getting on the road as well. So this is not too much for Stuart, though, because Stuart did 60 programs 2 years ago on the road, over 150 nights on the road. All right. So this is not a big deal. All right. The big deal is in getting people to learn what they need to or what they can learn and making things available for them. And that's what I am interested in, making sure that as many people with MS can get. Okay. So, yes, I pat myself on the back for that. And I think I'll have a couple of drinks tonight, too, and nobody can yell at me. All right. All right. Great. So here's another question. A person wants to write, I was now asking about cannabis and what type of cannabis can they use legally? All right. Obviously medical, but is there one grade over another that they should use to make them feel happy?
Sativa.
Okay. Got that, everybody? Sativa.
That was a simple answer.
Tell the world that Dr. Rick said sativa will make you happy. Okay, not seriously, but he's just answering a question. Okay.
So just so you know, as we know, in the state of Florida, we can get a script for medical marijuana, and the dispensaries sell different types and strains of marijuana. Typically, the indica strain is more sedating and more common. The sativa strain is more activating and more euphoric. They're also what we call hybrids, which is a combination of sativa and indica. So if you have a card, you can go to your local dispensary and they will help you find a strain that's appropriate for your particular issue.
Okay, thank you. All right, Lisa is writing something here. I'm going to read it to you. I didn't get a chance to read it first. I moved to a whole different county, but same plan. I had every therapist and monitored with every 9 years and haven't even had MRI. Oh my God, they don't have a MS neurologist. I have left my house in 8 years. How can I help? I haven't left my house in 8 years. Wow. How can I help myself?
Wow. So I think what becomes real important is what keeps you from leaving your house. That becomes so important. If it's anxiety, if it's panic attacks, if it's a fear of going out, there are so many ways to get help today. A year ago, more than that, 13 months ago, if you would have told me that I'd be doing therapy through virtual means, I would have committed you. I'm doing 100% virtual today. There's so much help out there. that can be done through telemedicine. Please reach out.
That's right. That's right. All right. Thank you for that. Next one. Here comes a good one. The fear of what's causing vaccine hesitancy. Those that have fear in getting the vaccine. Is there anything that you can talk about that in less than a half hour?
I, I hate, this is not a paid political announcement. I'm not endorsed by Pfizer, J&J, or Moderna. Look at the science. I just read an article today where they interviewed some of the premier scientists, epidemiology. A vaccine is so effective against COVID. The worst that'll happen is maybe you'll get some mild symptoms. The most recent research shows that it's even effective against variants. Okay? The incidence with J&J of having side effects was minuscule. I forgot the percentage. I can't understand why anyone would not get a vaccine. Just look at the science. That's what I'd recommend. Read the science. Don't read or follow what you see on the internet. Go to the CDC websites. Ask your physician.
And listen to me.
And listen to Stu.
It feels good. It felt great. It still feels great.
Doesn't it, Stu?
It does. So I had it back in February, and life changed for me. But more and more, as I see more and more people that have been vaccinated again, it's just great to be able to go into a room and not have any thought about getting sick. It's just a great feeling. Not sick from that anyway.
I remember
I still get sick, but not from that.
I remember going to Publix when
Right.
before I was vaccinated, and I would go grab a head of lettuce. And if someone came up behind me to grab a cucumber right next to me, I would get anxious. I would step away. You don't feel that anymore when you're vaccinated. You don't.
You don't.
Takes away suspiciousness, that anticipatory anxiety.
Right. So I've been on the road, since I haven't been locked down at all. And I've been on the road since the beginning. Instead of flying everywhere, I've been driving everywhere. And the discomfort about stopping at a rest area with so many people around, and half of them weren't wearing masks. And, me yelling at people, just stay away from me, and not wanting to touch anything. But now I walk into a rest area and I know 50% of the people are not going to be wearing masks, and I don't care. I'm wearing mine, and I'm very comfortable, though, that I don't even know why I'm wearing a mask, other than they say that you should be wearing a mask, and so I am for now. So
interesting, though, Stu. While I was waiting to come online, it was just watching the news. They're going to start removing the recommendation that those who've been vaccinated need to wear a mask, because the transfer rate is less than 0.1% or something like that.
Yeah, I heard that this afternoon. I was listening to one of the news stations whose name I'm not going to say because they don't need any endorsement. But yeah, they were talking about if you're vaccinated now, that now the health is that you don't need a mask at all anymore. So that's a great thing to hear. And I don't know where they come up with these things all the time, but we're learning every single day. All right. By the way, everybody, you all know that I wear a tie on my programs, and I show up to my programs with like 6 different ties and different shirts. And depending on how I'm feeling that day, depends on what I'm wearing. All right. So that's a wellness thing. All right. So tomorrow night's program, wow. I got all joyous ties to wear. And so if you want to be there for the program, again, because it's a great topic that we will be discussing, and for the others that write to me about my tie, because 4 people wrote to me about my shirt and my tie tonight. All right. But if you want to see what tomorrow's colors are going to be, it's something new. Okay. Something new. I had to buy a new wardrobe of shirts because some of these are getting played out online every week. All right. All right. So, we have one more question. And again, it has to do with the vaccines. It's about the children out there. So the parents many times are not getting vaccinated for whatever reason they are, but they're inflicting fear in their children as well. And those children are carrying it to other children. Is there anything that you can say to anybody that's listening about, what they can tell their children, and if they are vaccinated, but what their children can be taught from them or from you about how not to hear the fear from other kids in school?
So the good news is within a day or two, they're going to approve vaccines for kids.
Well, they did now for 12 to 15.
Did they finally? I think the FDA did. It hadn't been approved yet. But the FDA made that recommendation.
Okay.
I'm going to go back and you tell your kid, wait a minute, we can't control what other people do. You're going to wear a mask. We're going to make sure you keep your social distance. We can only control what we can do. And as long as we're maintaining what the recommendations, the probability of us being safe is real high. We can't control the family next to us that doesn't believe in vaccines or doesn't believe in masks. We're just going to make sure we're social distant. We'll wear our masks. We'll be safe.
Great. Thank you for that. And thank you, everybody, for being on here tonight. I mean, we don't have any more questions. We are going to, again, just announce that we have the program tomorrow night. And we do have a program on Thursday night where I will be interviewing people from the Consortium of Multiple Sclerosis Centers, which is a nurses organization. But, via those nurses, they're providing information for all the MS patients across the country. It is the CMSC that has that major conference once a year that this year will be held in Orlando, Florida, and this year being in October. So, they didn't know a few months ago whether or not they could have this program. Now they are having this program. And in fact, I have been asked to open up the meeting and talk about their very first speaker of the night or of the day. So that'll be a great thing as well. So anyway, I just want to thank everybody for being on here tonight. I do want to thank Dr. Harris. He will be with us again towards the end of the year to do another program, maybe one or two other programs. If you have any questions for Dr. Harris, you can send them to me and I will send them to him and he can answer you directly because I don't want to be in the middle of that. Okay. And this way it'll keep your confidentiality with whatever you need with him. Again, if you have any questions for me or our organization, MS Views and News, please just write to me directly. You have gotten emails from me, and you will continue to get emails from me. And again, I just want to say thank you for being here, and have a great night. Namaste. Be well, everybody. Ciao, ciao.